welcome to Hadassah On Call, New Frontiers in Medicine. I'm your host, Mayan Hoffman. Today, we're diving into a topic that affects millions, back health. We often take our backs for granted until pain strikes. With today's generation spending more time hunched over computers and phones, back pain is more prevalent than ever. Here are a few key points about back pain. About 84% of people worldwide will experience back pain at some point, affecting all age groups. While common and uncomfortable, back pain is rarely dangerous. Exercise is a powerful remedy. Experts recommend over 30 minutes of daily exercise for maximum benefits. Contrary to popular belief, aging doesn't necessarily cause or worsen lower back pain. Evidence-based treatments are effective at any age. Finally, poor posture or a weak core isn't the main culprit behind back pain. So what does cause back pain? To answer that, we'll be speaking with our Hadassah expert, spine surgeon, Professor Josh Schroeder. Welcome, Professor Schroeder.
Hi, thank you. Thank you for having me.
Of course, I want to jump right into one of the issues that is at hand, especially for women, which is osteoporosis, osteopenia, and how that impacts your back. Can you first start by telling me the difference between those two?
So it's a gray zone because the bone, women's or everyone's bones reaches a peak of velocity around the age of 30, 35, and then over the years it declines. And the decline grows worse as we age. And of course, when women enter menopause, and over those 5 to 10 years, the bone quality drops dramatically. And over the years, as the bone quality drops lower and lower, we go from from regular bone to osteopenia, and then later on to osteoporosis. And as the bones weaken, the bones at times cannot withstand everyday demands, and then they can break even from small things as a sneeze. We've had patients come in after COVID or after any kind of illness, and they broke vertebral bodies in their body. We've seen cases of patients that come in that they were on a bus or in a car, and the car went up and down, and they broke a vertebral body. And of course, household falls, which can cause many fractures. And vertebral fractures, the most common fractures in the human body.
It's really unbelievable when you think about it. I mean, what can you do, though, in order to detect it early to make sure there are things you can also, let's say, enhance in your lifestyle that will help to prevent it?
So I'd say from very early on, it's very important to take vitamin D and calcium. And we know that's a very good measure. And we know that there's a huge problem of lack of vitamin D going on. And the people that think that they're exposed to the sun and they're healthy, and many times they're low on their vitamin D, and it's a simple drop treatment. It started early on in life. Mm-hmm. We know the women, as they go through pregnancy and breastfeeding, they got to take supplements. And we know that that if you don't do it, you're just emptying out your batteries. And the mother creates a child in her uterus, and then when they breastfeed, they keep on giving more and more calcium to the children to create them, and that's coming out of her stocks. So if they don't fill it up actively, it's going to deplete over time.
And I know that you have some pretty crazy stories here, specifically in Jerusalem, where we see a lot more of this than we would in other parts of the world.
So we definitely see more osteoporosis and more compression fractures in young patients that we do not see in other parts in the world. And we've seen a pandemic of pregnant women and women breastfeeding with compression fractures of the spine. We have cases in the Jewish and the Arab population of young women coming in with terrible back pain, and initially said, brushed off, oh, it's your back's hurting you because you're a young mother. And then we do x-rays of them. They have multiple compression fractures, and then the vitamin D's are low, the calcium is low, and they only need to be treated for a year to 2 years afterwards with anabolic treatments, building treatments to deal with their problems.
And with regards to the children, I mean, we mentioned also there's some genetic issues that we see, mostly because of the more religious populations not wanting to abort when there is an issue. These kids are born, and you're doing some really wild things here at Hadassah that you might not see in other parts of the world as a result of that as well.
So, we're doing it. If for a second, I'm going to jump back on the older population. So because of the huge number of patients that we see with fractures in the spine, we had to create a new type of surgery, of awake surgery in these patients. The patients that cannot be put to sleep, then we can operate on them when they're awake. And mild sedation, we have a team put together. We work quickly. Just this morning, we had an 84-year-old lady who has multiple fractures in her spine and a really bad kyphosis. So we had to put screws in the spine and correct her spine because we couldn't put her to sleep. And that works very nicely. Last week, we did it on a person, a husband and wife, who were both involved in a very bad car accident. that could now withstand general surgery. And we're skipping to the younger population. I mean, Jerusalem, as you mentioned correctly, I mean, Jerusalem has a very large number of children that are born with genetic syndromes or with other health-related issues. And one of the complications of that care is having a spinal deformity. And dealing with these deformities is something that we've never seen in the past because medical care is just so much better today. So the kids survive into childhood and adulthood, and the medical care and the pediatricians do a tremendous job in keeping them alive and healthy. And then over the time, the spine bends into crazy angles that we need to fix because otherwise they're unable to walk or unable to sit in a chair. And these kids from diseases that we've known before, as such as the Duchenne muscular dystrophy, children with all kinds of genetic mutations that have been described here in Hadassah over the years. And now that these kids are reaching teenage ages, and we take them to the operating room and we deal with these difficult challenging cases. So we use robotics, we use ultrasonic knife, we use optic navigation. We pretty much have the cutting edge technology here in Hadassah to take these difficult and dire situations and bring the children to the other side. Now, I must say that Hadassah is a fantastic hospital, not just because of our surgical skills, but to take a child like this into a hospital and bring him out healthy on the other end requires teamwork. And the teamwork starts with his a pre-op evaluation. It's a team-wise evaluation, and we work together with the hospital, the next door hospital, Aline, which is a pediatric hospital next to us, and our anesthesiologists who are fantastic, who know how to deal with these cases. Our nursing care in the operating room and after and around the operating room, our technicians, our X-ray technicians, and of course our pediatric ICU units work very, very hard on bringing the children up to par before surgery and after surgery. And without having that great teamwork here in the Hadassah, we would not be able to take on these challenges cases and bring the children back to the comfort of their families in a better situation in which they came into.
And speaking of children, I mean, scoliosis is something that I think is identified generally in adolescents. How do you identify it, know that it's a problem, and what can you do to help slow down its progression if you do have scoliosis?
So scoliosis can be divided into two types. We have the idiopathic scoliosis, which is a common scoliosis that we know, which usually appears somewhere around the beginning of teenage age, and you need to be aware of it. Definitely in families that have a tendency for spinal deformities, it can be either kyphosis, which is an anterior bending of the spine, or scoliosis, in which the spine is bent sideways. And these treatments should be diagnosed earlier on. The care of the diagnosis is usually by a pediatrician or a family doctor or an orthopedic surgeon asking the child to bend forward and seeing that the shoulders are not leveled, or they usually appear and they notice that something in the spine looks funny in the child. When the scoliosis is diagnosed, then we need to take some x-rays. In today's world, we have special x-rays called the EOS x-rays, EOS, which Hadassah, thank God, also just got its first EOS system, which is a low radiation system to help reduce radiation for children, and allows us to take x-rays at about 1/3 to 1/4 of the radiation of a regular x-ray. And we see how bad the deformity is. And in a sense, we need to see if the deformity, what's the magnitude of the deformity and how much growth the child still has. And as the child's growing, if the deformity is above 25 degrees, then we'll brace him. And we have different types of braces to fit each kind of the deformity, and which are 3D printed in order to push the spine in the correct direction. We'll send the child to do PT and work on his posture and work in different systems to improve the evaluation. And the kids are quite good at the compliance, and we see in many cases the deformity is being halted with this technique and not reaching surgery. Of course, if the deformity is above a certain degree or it progresses, then we'll take the child to surgery. And here we have a whole set of techniques and how to correct it, from growing rods and magnetic rods, infusions and non-fusion techniques. And we have a whole array of treatments depending on the child's specific problem. We try to tailorize our treatment to the care that the child needs.
Now, it seems in general that the younger generation is having more back problems, at least it's hearing that. My own children, sitting all the time, playing on their phones, hunched over at the computer. Are you seeing that as well from a practical standpoint? And what are the things that we can do, again, to prevent that?
So So that's a great question because we definitely see more back issues with younger populations that we did not see in the past. And I divide it into two types of children. We have the hyperactive child and the underactive child. So let's just separate into the two. So the underactive child, the children that don't do any exercise, are sitting on the phone and they're bent forward all day long and sitting down, develop at a younger teener age, just develop lower back pain like you would see in a sedentary grown up. They need to be pushed a bit to go into doing some sports, working on core muscle strengthening, swimming, Pilates, gyms. There are quite a few different courses out there now for teenage children, religious, non-religious, all over the place. There are a lot of teenage type activities there that can be tailored for the children, then, and they can help them get into shape and help them work with that.
I'm assuming that the lower back pain is not dangerous, it's just painful.
It's painful, but any child that has a significant back pain has to be seen. It's one of our red flags that we do tend to, or if it's a child that comes back and says, "Oh, I was out with my friends and I was in the gym and I came back with some lower back pain," further, it's probably not. But if it's significant back pain, it's definitely one of our red flags that we need to see. The second cause of back pain in the children is overactive children, and many times we see stress fractures in children, and in many in the backs, yeah. And it's probably the most common cause. We see disc herniations also in children, but the kids are doing gymnastics, doing elite sports anywhere. We know that the rate of these stress fractures, what's called spondylolysis, is somewhere between 20 to 80% of the children in different activities. And then if a child is active, sometimes kids go a bit over with. I have kids coming in that are dancing 6 hours a day, and I have kids that come in with 12 to 16 hours of gymnastics and fencing and swimming, and sometimes they want to be a professional sportsman, or not even a professional, but I'd say competing level athlete. And I'm putting in here not just regular sports, but also dancing and any kind of physical activity that kids love to do. And it's great to see our kids performing at the end of the year, but many times the strain on the body is not evaluated properly in a growing child. Now, in the United States, they've gone through this significantly with professional sports. Kids who go through professional training, such as baseball and football and even soccer, undergo testing and evaluation by the sport doctors to limit the amount of activities that they do to prevent fractures. Regarding the spine, and definitely in Israel, and definitely amongst other sports that are less evaluated, it's not developed as much. And these kids sometimes can reach that point where they actually break the bones in their back, doing backflips and doing all that stuff. And it reaches a point where we got to operate on these children because the fractures are bad. And I see now with the combat in Gaza, I see a lot of them coming back. The soldiers have been carrying heavy weights in their back and just come out of there, and they're from elite units. These are young, healthy guys that just the strain on the body, like any other part of the body, can break. We know stress fractures in the legs and the feet, and we're seeing it more and more in the spine as well.
Wow, it's actually, I didn't think about that with the soldiers. That's really fascinating. You're seeing a lot of patients here that have come out of the war.
Coming out of the war, patients that are, I think that, the war has brought, we see trauma, of course. And Hadassah as a level 1 trauma center in Israel. We get our share of patients being choppered in. We see spine fractures and operating on soldiers that have bad, bullets and shrapnel and bad fractures, and people anywhere from active combat to people that flip jeeps in Gaza and or been fallen off buildings. We've seen we've, thank God, the patients do well afterwards, and the rehab work here is fantastic on them. And but we also see the overuse. 8, 9, 10 months of combat on reserve duty soldiers, on regular soldiers, takes its toll. You take a 35-year-old guy from his everyday life doing something office based usually into an active role in Gaza, and they go in with 30, 40 kilos on their back in weeks at a time, and they come back with back issues. Some of them have more significant, some of them have herniations, some of them have anything that you'd see in older population that goes through these intense combat situations. So they come to us quite a bit. They fill us in the clinic, and we're happy to take care of them. And we give them good medical care and good advice. And the rehab center is fantastic that exists. And having all of that here in our facilities and here in Hadassah makes us a really, I'd say, well-rounded medical center to take them from day one when they arrive and all the way home till they go home afterwards.
So I want to jump back to the athletics question. I'm a runner and I do distance running. So I could run, let's say marathon length. And sometimes what I find is the longer you run, the lower back starts to hurt. Is that because of the combination of the core and the lower back? How are those tied together?
I think that in many times a repetitive motion can cause some strain on the muscles of the lower back, and definitely recommend people not just doing one type of sport, but also adding on sports. We know that runners, and this is from my experience in New York, that we know that runners have very good leg muscles, but even glute muscles are very weak in them, and many times they have suffer from injuries because of that. And if you're a marathon runner, it's good to have a proper evaluation in our sports clinic to see what's weak in you and work on those other muscles that have been neglected. People also can, we know that people like to focus on one area, and then people forget about their shoulders and forget about their back muscles and forget about their stomach muscles. And when it goes to that limitation, that's when it starts to ache after some time. And the second thing I'd say is, with the years, we have some wear and tear on different parts in our body, and it's part of life having some pain.
So, what do you think are some of the preventative measures that the average person can do in order to ensure a healthy back beginning from a young age so that they're more likely to not be in pain when they get older?
Um, that's that's a great question. I think probably keeping active but not too active.
Right, you can't win. If you work out too much, you get stress fractures and pain. And if you don't work out, then you have pain. So,
Right, you need to find that middle path in between, and the limitation. Things should be addressed in the right time. I think that flexibility is important, and I think core muscle is important. I think as definitely in the women's population, with pregnancies and childbirth, we lose a lot of our core muscles with it. The accordion effect, the stretching of the muscles and closing it weakens them down and needs an active role. And I think that the earlier you start in that a routine will help you as we progress in life. And of course, bone health is as important as muscle health. And we see the ladies coming in 50s and 60s with broken backs already, and it's a shame because you discuss it now when no one told us about it before. And I think like everything in life, the preventive medicine is probably the best medicine. And vitamin D, calcium throughout the time, multivitamins, making sure we have a good nutrition, making sure not neglecting those things is probably the best advice we can give.
I was just going to ask you about that with nutrition. I mean, you mentioned the supplements. Are there specific foods or specific diet kind of plans that would be helpful as well?
I I'm not an expert at that, but I do recommend at least doing once a vitamin D level, blood level test, and it's just a simple blood work, and it's a couple of drops a day if you're missing it or finding the vitamin D and calcium. And sometimes we think that the other issues, many times we think we have a balanced body, and our body just doesn't absorb the specific vitamin. And the intestines are a complex organism, and we need to figure out within that system how to, if we need to take a little bit more than what we need to feel because we're not absorbing as much as we should, and then we can run into some kind of deficit like iron or like any of the other vitamins that we may be short of.
Now, of course, most of our listeners are probably a little bit older, and so some of the prevention it might be too late in some sense. But what kind of treatments when you're older, like alternative treatments, acupuncture, massage, do any of these things actually help as well?
For back pain, yes. It We actually have good medical literature on that stuff, and I'd say there are many, many different modalities out there for. I mean, back pain in general is a huge issue because we know that at any given time, 8% of the population has back pain that reaches significant care. So if you just take the Jerusalem area, we're talking about 80,000 people out of the million people that live in Jerusalem. If you're going to bigger cities, you're talking about hundreds of thousands of people per day. So there are many, many different modalities to deal with that stuff. Anywhere, as you mentioned, acupuncture, massages, and you pretty much need to choose what works for you in that sense. And they're all about equal, and they all help. And some of it's due to muscle spasms, some of it's due to tension, it's some of it's due to joint degeneration, and there are many, many different causes that factor into the back. And most of it can go away with a simple pill or just some proper PT. But I think having a healthy and more, I'd say, in a better lifestyle, in the sense of combining sports and not just being a certain lifestyle, anywhere from swimming to Pilates and yoga and a gym. Find whatever you like to do and do it because it's better than just sitting around and doing. You like to run, great. Add those exercises. You hate to run, swim. You hate to swim, find a gym where you like to do it. Just find something because it needs to be, in Hebrew we say, "Ochot chaim," needs to be part of your everyday lifestyle, because and that's what's going to make you healthy for your diabetes, for your heart disease, and also for your back issues.
Sure. Now, last question is actually tied to technology. I know there are a lot of new technologies. You mentioned the robots before that are being used both at Hadassah, but also in the world in general. I'm wondering if you can talk to some of that new technology, how it's being used, and what you're most excited about for the future.
So, a technology is great, and the technology can come in anywhere from identifying patients and finding patients in need. We know that we have a shortage of finding out who we need to take care of, and that's where AI is coming in. And we know that, I mean, I mentioned before, we have 80,000 people per day in Jerusalem with back pain. We need to filter out between these 80,000 people who has a cancer with the metastasis, is going to be paralyzed if we don't take care of him, and who just needs a simple paracetamol or just rest in bed for a day, you'll be better tomorrow. And we're hoping, and it's not just Hadassah, the entire medical system is not able to deal with it properly. In today's world, identifying back issues back issues are the number one source of missed working days in the Western world today. So it's a huge, huge, huge issue, and you got to filter out. No one wants to miss a cancer patient, and no one wants to miss the case he's not going to sleep at night. But we don't want to overtreat people that we don't need to treat. We can't send everyone to doing MRIs. So that's what we're hoping, where AI and identification technology is going to help us filter out the proper patients properly. When they come into the hospital and they have an issue, then we need to have better systems to identify the problem. And again, we have systems coming in with technology, looking at CTs and MRIs, helping us do automatic reading of those machines. We're not yet perfect of those readings. We have IDOC, we have a system in Hadassah, that's an Israeli company, that helps try to identify fractures in spine early. I wouldn't say we're 100% there, but it's definitely better than zero. So it's a work in progress. In the operating room, we have technologies that help us be more accurate and make sure that human error does not happen as frequently. And this is where the robotics come in, and this is where the navigation software comes in. And these are systems, and spine surgery, a 2-3 millimeter mistake can create a huge problem later on. And if you move yourself off in the wrong direction, you can hit a vital organ or create paralysis, and you really got to know your way around the spine. And the robotics help us place the screws and do our decompressions properly. We have a combination of navigation and robotics now here. We have an optic navigation system, which is the next forefront in technology, which allows us to track in real time using optics and no radiation involved the patients, the course of surgery as we're going on. So I think it's a exciting era. And if we want to take post-surgery, if patients have deficits, the rehab centers have a lot of technology there helping bring back people from deficits back to better life. We've seen it with soldiers. We've seen it with people with all these new tools coming out using games, software games, and everything. So pretty much from identification till treatment, it's great. And but also, if we're talking about envisioning things, hopefully the next line of care, and we're thinking about it also, and hopefully one day we'll get to do it, is taking people that are paralyzed and finding technological solutions of implanting chips and electrodes, getting them back to walk again. And that's in the process, and there, I wish we would have, it needs huge resources to get it there, but I think that technology is out there today, and if we put a focused effort on it, and hopefully, if funds are freed after the war, and we put less into saving our people and into ending wars and
Well, this would be saving our people too,
right
in a different way.
Then we'll be able to focus on that as well and bring that technology into effect to treating our patients. We're not that far from that, getting back paralyzed people back. And of course, we have the stem cell world and all that stuff that's a little bit slower, because biology is so complex that we understand that we go 2 steps forward, we go 1 step back. Sure. And every success has 2 failures behind it. We know that. But technology is more straightforward, and we know that in many places it's a much easier leap advance. So I think technology here will win over biology, and we'll have these combinations, like we have the electrodes that are going for Parkinson's and for eyesight and for hearing aid, and hopefully for paralysis as well somewhere down the road.
Oh, it's a beautiful vision. Well, Professor Schroeder, thank you so much for being here today.
Thank you for having me.